is a video for those women who find that they leak urine during exercise. So depending on the different exercise, there's a lot of different techniques that you can use to reduce the impact forces on the pelvic floor, and also your body positioning should be in a specific way for a particular exercise. So some of the common ones that people leak with we'll start with squat jumps. So when you're landing in your jump, a lot of women think that it's better for them to brace their pelvic floor and their core on the landing, when in actual fact your pelvic floor needs to be able to open up and to stretch to absorb the force of the impact, because that is what the muscle is designed to do. If you're bracing on the landing, you're actually going to increase the forces within the pelvic floor. But there are a couple of things that you can do to reduce the amount of force traveling through the pelvic floor as well. So one thing is to keep a little bit of a forward lean with your landing, and then another thing is that you can exhale as you're landing into the squat jump to blow off some of the pressure. So our mouth is a very useful tool in terms of managing intra-abdominal pressure, and think of it like a valve to your canister. Your abdominals, your pelvic floor and your diaphragm form a canister, and that canister contains the pressure. When that pressure is stabilized, it protects our spine, but also if we add too much force onto that while we're in a brace position, you can get that reaction of leaking as well. So to reduce the instance of that happening, keep a forward lean in your landing. Try to land softly as well, like let your body go with it. Don't brace and try to halt while you're landing. Let your body go down, let your pelvic floor open as you're landing. Keep a forward lean and blow off that extra amount of pressure that's created by the landing with the valve that is your mouth to reduce the pressure. Another one is running. So running is quite a jolting exercise on the body through the pelvic floor. Again, we don't want to be bracing our pelvic floor or our abdominals while we're running. We want to allow our body to move. And if you're doing all of these things and you're still leaking while you're running, then you have an underlying issue that you need to look at. It might be that your pelvic floor is hypertonic or too tight, or it could be another structural issue which you could look into as well. But to reduce the impact forces on the pelvic floor while you're running, again, keeping a bit of a forward lean. You want to try to have your rib cage and your pelvis stacked into each other, and with your forward lean, I'm trying to go through the roundabout at the same time. You want to rotate as you're moving. So a lot of women try to sort of force their arms forward to propel your body forward. You actually want to rotate from the torso. So if you think your arms should be relaxed, and then the movement of your arms will happen, but it's not coming from swinging your arm forward. You would if you were sprinting, but if you're just running, like jogging, then your rotation will come from the torso. So your rib cage is coming forward, and your arm therefore comes forward. You're not throwing your arm forward in the effort to try to pull your body forward. If you're doing all of those things, and again, landing gently with a midfoot landing in terms of reducing impact forces on the pelvic floor, then you may have an underlying issue which you want to check out. So yeah, just a quick little tip for today. If you have any questions, let me know. Otherwise, I hope this helps somebody. Using your pressure system and your exhales is one of the most powerful tools that you can have in your toolbox to overcome managing intra-abdominal pressure.